there's a lot of excitement around using AI to better identify HER2 low breast cancer compared to traditional IHC scoring. What are the limitations of current uh, HER2 classification, and how might quantitative AI approaches improve patient stratification for HER2 targeted therapies?
Yeah, that's a great question, and kind of gets back to, as I mentioned earlier, the current HER2 immunohistochemistry assays are optimized to distinguish HER2 2 plus from 3 plus cases, identifying those that are more highly HER2 amplified, what we've traditionally called HER2 positive breast cancer, and are really not optimized to distinguish lower levels of HER2 expression. David Rim's group has done a lot of the analysis demonstrating pathologist discrepancy and categorizing some of these lower groups of HER2 expression. And so it's kind of a matter of just this assay was not optimized for distinguishing HER2 expression at those lower levels. Um, I think that as the study that I mentioned from ASCO demonstrated, these AI approaches at least can improve consistency by doing this in a very rigorous, systematic, and automated fashion. There have been other studies that have shown that the AI quantification can correlate with, for example, HER2 mRNA expression at lower levels of this HER2 dynamic range than you might expect from a pathologist reviewing these slides. And I think it's that more precise quantification that would allow for more precise HER2 stratification to identify those HER2 zero from ultra low patients who currently have an indication for HER2-directed antibody drug conjugates. There's another sort of related question is, do we need to quantify HER2 better at the lower end of this range to identify the patients appropriate for this treatment? There's a study, again, David Rim is doing the correlative work for the study called Quantify Her that's using quantitative immunofluorescence to capture HER2 expression at the lower end of the dynamic range. So perhaps a different assay or, the AI approach will allow us to better identify patients at this low end of the expression range who may benefit from HER2-directed therapy. On the other hand, there's also an open question, and there's an interesting clinical controversies at San Antonio this year on, are antibody drug conjugates targeted therapies or are they not? And so there's some debate on, at this low level of the expression range, is the is the efficacy of the drug really because it's binding to some of that HER2 protein on cancer cells and releasing the payload? Or are there mechanisms of payload release that are independent on tumor antigen expression? And there's a few potential mechanisms, such as release of lysozymal enzymes into the microenvironment that might cleave the payload even if the tumor doesn't have antigen expression. You get a high amount of payload that's in the circulating bloodstream. And so this is detailed more in this controversy session, which would be good to, for people who are interested, definitely encourage watching it. But if ADCs are not as targeted as we think, especially at the low end of this expression range, then accurately quantifying it will HER2 expression at that end of the range won't help us select patients better for treatment. So I guess we'll have to see.